patients, more than close to more than 70% of patients in India have vitamin D deficiency. And in children, we know that lack of vitamin D can lead to stunted growth. There's a condition called rickets, which is due to vitamin D deficiency. In adults, vitamin D deficiency can lead to multiple complications. Most of us are aware of osteoporosis, fractures, but there are new data which shows that vitamin D deficiency can lead to cancers and other cardiac conditions. So if we look at vitamin D deficiency, the most common cause of low vitamin D is lack of sun exposure. For us to absorb vitamin D levels at a stable level, we need to be in the sun for approximately 20 minutes, with 40% of our body being exposed to the sun. So when we are not exposed to the sun for at least 20 minutes every day, most of us will develop vitamin D deficiency. The other causes of vitamin D deficiency would be patients with bowel diseases, like patients with who've had previous surgeries on the abdomen, like patients with short bowel syndrome, patients with there's a condition called celiac disease, in which there's problems with absorption of vitamins, including vitamin D. Then you have patients with inflammatory bowel disease, which is a condition where there's inflammation in the colon and small intestine, which can there's a condition called ulcerative colitis, and another condition called Crohn's disease, which can lead to vitamin D deficiency. Also, patients who've had previous stomach surgeries, whether it's for obesity or for cancers, all these are patients who cannot absorb vitamin D levels, so they all have a higher risk of vitamin D deficiency. In addition, patients with liver disease and patients with kidney disease have low vitamin D. Now, if you look at foods that have vitamin D, most of the milk products and including milk, cheese, yogurt, all these lately have been fortified with vitamin D. So that's one way to get vitamin D in your diet. The other foods include fatty fish like salmon and cod liver oil. All these have vitamin D levels added in them. What happens when your vitamin D levels are low? If you look at the data clearly shows that patients with low vitamin D have higher risk of osteoporosis, which can lead to fractures in the, mostly spontaneous fractures in the back. When you fall, there's a risk of fracture in the hips, fracture in the wrists and elsewhere. In addition, new data which was just recently published looked at close to 300,000 patients in Australia, and what they found was patients with low vitamin D had a significantly higher risk of dying. Overall, in general, patients with low vitamin D had a higher risk of dying from all causes. And then when they looked at different causes like cancers, heart disease, what they found was that those with a vitamin D level less than 25 had a higher risk of dying from cancers like breast cancer and colorectal cancer. They also found that those with low vitamin D had a higher risk of heart disease and heart failure. And in patients with respiratory conditions like COPD, which is a chronic obstructive lung disease, which is commonly seen in smokers, what they found was if you had low vitamin D, your risk of frequent lung infections and exacerbations of COPD was high. And what they also found was that patients with low vitamin D had a higher risk of high blood pressure and higher risk of inflammation in the body, which in turn can lead to other problems. And based on previous data, we know that patients who are supplemented with vitamin D have a reduced risk of inflammation from osteoarthritis, inflammation from inflammatory conditions like rheumatoid arthritis and lupus. So clearly, if you have low vitamin D, there's a significant risk of multiple problems, including cancers, heart disease, blood pressure, and other things. And in fact, in diabetics, they found that patients with low vitamin D had a significantly higher risk of what's called insulin resistance, where your body has insulin but it's not working, so your levels of blood sugars are elevated. So that's where the significance of testing for vitamin D is extremely important. Now, how do we prevent vitamin D deficiency? One way to prevent vitamin D deficiency is being in the sun for 20 minutes every day, wearing your shorts or t-shirts, so that you have at least 40% of your body exposed to sun. The other way to reduce vitamin D deficiency is by taking supplements, vitamin D3, 1,000 to 2,000 units, 1,000 to 2,000 units daily. Now, in patients who are frail, patients who are advanced age, patients who are bedbound, patients who are in nursing homes, all these are patients who are not exposed to, or patients not exposed to sun at all. The risk of osteoporosis and falls is extremely high, and so these patients should be clearly be taking at least 2,000 units every day of vitamin D3. Now, for the treatment, let's say you get tested for vitamin D and your levels are low. Now, the normal range is supposed to be between a minimum of 30 to a max of 100. And ideally, our target is to be around 50 to 60, have a vitamin D level of 50 to 60. If your levels are less than 30, then you're being labeled as having low vitamin D. If your level is less than 25, you're labeled as having mild deficiency. If it's less than 15, it's moderate deficiency, and less than 5 is severe vitamin D deficiency. So the treatment is very simple. We have treatments, there's a once a week capsule, vitamin D high dose capsule, 60,000 units. You take that once a week for about approximately 8 weeks. And after 8 weeks, you switch to a once a month capsule. And usually that will be enough to keep your levels at a stable level around 50 to 60. And that's a simple way to increase your vitamin D. Now, in patients who are on vitamin D, it's very important to periodically get tested at least every 4 to 6 months to see where your levels are. Because what happens if somebody's forgot to stop the medicine and is taking the medicine every day, or is taking the medicine every week for months and months. So in those patients, vitamin D toxicity can set in, and which in turn can lead to complications like too much calcium in the blood, which in turn can lead to patients being confused, patients having nausea, vomiting, unsteady gait, falls. So there's a bunch of things that can happen when your vitamin D levels are high. So it's very, very important that if you're on vitamin D treatment, after 6 to 8 weeks of being treated with once a week capsule, you switch to once a month. So usually once a month is the standard for maintenance. Thank you. If you have any questions, you can, I'll be ready to answer your questions at this time. Last caller. Okay. Oh. So the first question is about how vitamin D is helpful to us. In our body, for absorption of calcium, we need vitamin D, and so if you have low vitamin D, your calcium levels may be low, or there's absorption of calcium in the stomach and in the liver where it's metabolized. All that is affected if you have vitamin D deficiency. So it's very important to have your vitamin D and calcium levels checked periodically. What are the signs and symptoms of vitamin D deficiency is the next question. For patients with low vitamin D, extreme low vitamin D levels can have fatigue. They could have bone pains, they could have muscle pains, they could have hair loss, they could have just overall generalized feeling of malaise. So, but the most common symptoms are joint pain, generalized body aches and muscle aches. And you could have patients just lack of energy could be one of the symptoms. And the next question is about vitamin D and improving the IQ levels in children. This is something that is beyond my expertise. I have not heard, from what I've read, I haven't seen any studies on that, but in adults we know that patients with low vitamin D have a higher risk of dementia, which is memory loss. But in children, I'm not sure about the right answer, so I would definitely check with the pediatrician on that. What is rickets is the next question, and are there really impact on what is impact on body health? Rickets is a condition where kids or adults with vitamin D deficiency have stunted growth. They could have joint pains, the risk of fractures. So, and usually we see this in patients who are malnourished, or patients with malabsorption problems, or patients who are being mistreated. So these are patients who their nutrition is bad, or they have absorption issues. In these patients, we see lack of growth. Their bone growth is really limited, and so that is where rickets sets in. The next question is, what are the foods that are high in vitamin D? Now, the only foods, most of the foods are your milk products, milk, your cheese, buttermilk, yogurt. All these milk usually has vitamin D added in them, so that's one way to get it. And the other thing is eating fatty fish like salmon. And then you also can take, there's a capsule called cod liver oil, which has vitamin D. So that's the way to get vitamin D in your diet. The next question is, can vitamin D help with weight loss? And the answer is, I don't think there are any studies to prove that yet. From what we know so far, lack of vitamin D will lead to increased inflammation, which in turn can lead to joint pains, autoimmune conditions like lupus and rheumatoid arthritis. So at this stage, there are no studies explaining any relation between weight loss and vitamin D. The next question is dark skin good for vitamin D? The answer is, studies show that if your skin is dark, absorption of vitamin D is affected. In other words, you're more prone to having low vitamin D. So definitely people who are dark should get tested for vitamin D, and if the levels are low, should be started on some kind of supplements, in addition to being in the sun morning or evening for 30 minutes. The next question is, which fish is good for vitamin D? And it'll be fatty fish like salmon is the best one that I know of. In supplements, there's cod liver oil, which is also made from fish called cod, and that also has vitamin D added in them. The next question is, can we take medicines for vitamin D? So the common, we have different kinds of brand names for vitamin D. Standard recommendation is to start 50 to 60,000 units. It comes in a capsule form, and you can take that once a week for approximately about 8 weeks. If your levels are on the higher side, low normal, if it's really low, 8 weeks. If it's like on the lower end of normal, you could do even 6 weeks. Once a week, 60,000 units is a standard dose that we have here in Hyderabad. The next question is about dietary supplements, where it's safe and effective. Now, from what we know, there's no specific supplement for vitamin D deficiency. Like I said, you have a prescription, and there's a capsule that you can get over the counter, like you can go to the pharmacy and request. There is a capsule called Uprise D3 is a brand that we use here. There's another one called Lumia, Lumia. It's a capsule. It also is a company, there's a company that makes this capsule, 60,000 units, and you can do that once a week for about approximately 6 weeks to bring your levels up. But the most important thing is, after that, you need to be on the capsule once a month to keep your levels stable. The next question is, what is the difference between RDA and DEV for a vitamin or mineral? The RDA is a daily recommended dose that, like when you're taking especially supplements, they have on the side it says This is the percentage of daily vitamin that's in the supplement. The DV is something that I'm not aware of. I have to check on that to give you an answer. What are the consequences of vitamin D deficiency is the next question. The answer is low vitamin D can lead to reduced calcium absorption, which in turn can lead to osteoporosis, which in turn can lead to fractures in most patients, especially the elderly, women beyond 65, or patients who are sick with liver disease, patients who are frail. So in all these patients, there's a risk of fracture is the most common problem. And then you have the new data which is showing that if your levels are low, there's a significantly higher risk of dying from all causes, the risk of heart disease, heart failure, risk of cancers. So there's a bunch of other conditions that you're risking if your levels are low. The next question is about, again, intake of vitamin D and how does it protect against cancer or other diseases. So what we know based on the study so far is if your levels are low, there's a higher risk of cancers, especially breast cancer and colorectal cancer. Now, in terms of the question is, does vitamin D prevent cancer? Those are studies that have not been done yet. So they're looking at those at this point. We know that if your levels are low, there's a higher risk of cancer, higher risk of fractures, higher risk of heart disease. But for cancers and heart disease, they're looking at studies to see if you take vitamin D, is it preventing the cancer? That is a question that we don't know the answer yet, and it is being looked at this point. What groups are at risk of vitamin D deficiency is the next question. The most common groups are patients who are bedridden for whatever reason, patients with a stroke or paralyzed, or patients who are extremely frail and unable to walk, so they're mostly at home, or patients who are elderly, patients who are on steroids, patients who are on who have gastrointestinal problems, chronic absorption problems, whether it is colitis or those who had previous surgeries on the stomach. All these are patients who have a higher risk of vitamin D deficiency. You also have patients with liver disease and kidney disease. They also have a higher risk of vitamin D deficiency. The next question is about patients whose hemoglobin is low and how to improve it. Now, typically in young women, when the hemoglobin is low, it's a sign of mostly iron deficiency. So ideally, when your hemoglobin is low, you need to have a blood test to check your iron levels. It's called iron profile to check your iron levels. There's another test called TIBC, another one called ferritin. These are all your iron levels. In addition, you need to be tested for vitamin B12 and folic acid. And depending on what the levels are, where there's a deficiency, then we can give you a supplement for that. If your if your iron levels are low, there's a tablet for that. The B12 levels are low, there's an injection or a tablet for that. If your folic acid is low, there's a tablet for that. So depending on what the cause of the anemia is, then we target that specific problem. The next question is, how much vitamin D does the human body need, and how can the supply be determined? So typically, most people need about close to 1,000 to 2,000 units. It depends on how much sun exposure you have. If you have partial sun, let's say you're exposed to sun maybe 10 minutes, then you might need 1,000 units. If you're exposed 20-30 minutes, if you're wearing your shorts and t-shirts and you're in the sun 20-30 minutes, then you probably will be fine without any supplements. So it all depends on how much sun are you being exposed to on a daily basis. But typically the recommendations are most patients need about 2,000 units, especially for if your skin is dark. Indians probably need close to 2,000 units daily. And the question is, how do you determine the supply? So the simple blood test, you don't need to be fasting, and the blood test is basically a vitamin D level test. And depending on where your levels are, you can decide whether you need to be treated with any kind of capsule, vitamin D high dose capsules. The next question is, what are the symptoms of vitamin deficiency, D deficiency? I'm not sure, and it says anemia also. Vitamin D deficiency, most patients have joint pains and muscle aches. In addition, patients can have fatigue, can have hair loss, can have just lack of appetite, feeling down and depressed. So these are all symptoms of vitamin D deficiency. The next question is there a link between depression and B12 deficiency? The answer is no, because typically B12 deficiency is seen in patients who don't eat meats, especially patients who are complete vegetarians, because normally for absorption of B12 you need to be eating some kind of animal protein. So there's another condition called pernicious anemia, where you have abnormal proteins that are preventing absorption of vitamin B12 in the stomach. That can be seen in patients irrespective of whether you eat or not, whether you eat meats or not. So you have two kinds of patients. Patients who are vegetarian have a higher risk of B12 deficiency. And then this condition called pernicious anemia, where there's a problem with absorption because of abnormal proteins. These are patients who can have B12 deficiency. In addition, patients who have any kind of stomach issues, gastrointestinal issues, whether it is patients with previous surgeries on the stomach, then they can't absorb B12, or patients who have problems with small intestine or colon, who have inflammation in the colon called colitis, Crohn's colitis or ulcerative colitis. These are all conditions where there's a problem with absorption of B12. And there's another condition called celiac disease, where there's an abnormal protein, again, which causes the small intestine to prevent absorption of B12. So these are all different conditions associated with B12 deficiency. But there's no link between depression and B12 deficiency that I am aware of. I have to look at that specifically to see if there's any link. But as far as I'm aware, there's no link between, specific link between depression and vitamin B12 deficiency. Thank you.